Anchoring is something I use with every single patient that I help for the main reason it is super effective, it works very, very well, and it's super easy to learn and get working. In fact, it's so easy that I'm going to teach you how to do it in this short video, and then you'll be able to use it as well. So I guess first off, what is an anchor? What does that term actually mean? An anchor is something physical, something sensory that evokes an emotional reaction, a spontaneous reaction. Now, most of the time that can happen spontaneously, so you've not intentionally set it up. The thing that you either see, feel, taste, touch or hear just causes that emotional reaction. And that emotional reaction can either be negative or it can be positive. You just feel a certain way. So what are some examples of that? Well, I guess in the dental setting, an example of a negative one would be the sound of the drill, or when a patient walks in the practice, they get the smell of the practice, the sight of the needle. These are things create that very powerful but spontaneous emotional reaction. It can happen positively as well. So you hear a song that you love and it changes how you feel. You smell something that reminds you of your granny's baking, and it takes you back. You look at a photograph of a loved one. These are positive anchors and create a positive emotional reaction. It can also be things like a piece of jewellery that has a sentimental value to you. A memento from a holiday, a souvenir, even a pebble or a shell you collected from the beach that takes you back. It's probably where people get the superstitions and lucky mascots and a lucky pen for exams, all these types of things. That all is anchoring. Now, most of the time that just happens, as I say, in a spontaneous way. It's not intentionally set up. You just feel that way when you see, feel, hear, touch, smell that certain thing. Now, the beauty of learning anchoring and understanding how that process works is you can actually learn how to harness that phenomenon. So what we do in training people about anchoring is we learn a specific signal that you can do that will recreate an emotional reaction, a spontaneous emotional reaction. So the signal I will usually teach people is very simple, and it is touching your thumb and either your middle finger or your index finger, whichever's more comfortable, squeezing them together on your non-dominant hand. So for me, I'm right-handed, so I will use my left hand to trigger my anchor. Now, obviously, if you do this and you've not set up an anchor, all you're doing is squeezing your fingers together, and it doesn't change how you feel. So you have to set it up. So how do we set it up? Well, we set it up sometimes in hypnosis during the hypnotic session by asking somebody to recreate and reimagine certain emotional reactions or feelings that they've had in the past, of confidence, of feeling calm, of feeling in control, of being able to cope. But you can also build into your anchor in everyday life when things happen where you feel those emotions, where you feel relaxed, where you feel calm, in control, confident, able to cope. And actually, the more powerful that experience, the stronger your anchor is going to become. Because your anchor is a bit like a bank account, okay? You have to deposit the good feelings into and tying it into that signal for it to become powerful, okay? And you have to keep depositing and keep depositing and keep depositing until that sensation of me squeezing my thumb and my finger together just spontaneously is linked with that powerful emotion. So building your anchor is really, really important before you start being able to withdraw those feelings and use them when you need them. So anytime somebody gives you a compliment, you anchor it. Anytime you do something and it's successful, you anchor it. Anytime you achieve something, you anchor it. Anytime your football team scores a goal, anchor it. Just anchor every single positive emotion you have in your day-to-day life. Something good happens, you anchor it. Now, having deposited and put so much into this anchor, then the next time something happens or you're in a situation where ordinarily you would feel anxious or feel a bit out of control or unsure, you're then able to give yourself this signal, and what it does is it draws on that reservoir that you have of positive feelings and feeling able to cope. Now, I'm not saying that you're going to press the anchor and suddenly feel that the world is perfect and everything's okay. But what it does do is it takes you from feeling out of control and feeling anxious and worried, and it allows you to move up at least into a more neutral zone where you feel like you're able to cope and deal with whatever it is that's going to happen. So for, often I'll go into the patient lounge and go to get my next patient, and because I've taught them anchoring, I can see them sitting on the sofa in the lounge, and they're just sitting with their anchor firing. And because this is such an unobvious thing, you can be doing this anywhere, anytime, without anyone noticing that you're actually drawing on your anchor. Again, you use your non-dominant hand, and the reason for that is if you are writing an exam or you need your dominant hand for something else, you can use it. But also your left side and your left hand is linked to your right brain, so it tends to just be that little bit more powerful if you use it in the non-dominant side. So that's a little introduction to anchoring. There's probably more to it, and probably more I could say about it, but it's very, very simple. And I've taught that to my children. I'll see them at school sports day, and they'll be pressing their anchor just before they get going. And they have to be realistic things that you put in, and realistic emotions that people have had, and you're simply able to re-access them. So you're not inventing emotions that somebody's not able to have. You're re-accessing things that they've experienced at least at some point in their life, and giving them an ability to unlock that door to re-experience some of those emotions at the times when they actually feel they really need them the most. So I hope you find this useful. And I hope anchoring is something you're able to introduce into your own life and teach it to your patients, teach it to your family, because it's something I think is a life skill, and it's something we should all be able to use and just be able to have a little bit more control over our own emotional reactions and well-being. So I hope it's useful, and I hope you have a good weekend. I know I'm going to.